Hi, everybody. Welcome to the Kidney Coach YouTube channel. I'm naturopathic Dr. Fiona Chin, co-founder of the Kidney Disease Solution and head formulator at Kaigenesis, our nutritional range of supplements that go with our Kidney Disease Solution program. And I'm joined again today by the amazing Lindsey Zirker. She loves to nerd out just like I do on all things biochemistry and processes and kidney disease. And so, Lindsey, thank you for coming back and nerding out with me on a topic that I think our listeners will find really interesting. How are you?
I'm doing well. Yes, you can invite me to nerd out anytime, and I know your eyes won't glaze over, which makes me feel happy.
No, I just get excited. So last time we spoke about important minerals and their role in chronic kidney disease, and we thought today we would dive into the world of vitamins and which ones are super important when it comes to kidney disease. So shall I just hand it across to you and you can take the floor with all things vitamins and kidney disease?
Sure, feel free to ask any other questions or remind me of things that we wanted to
Okay,
talk about.
can do.
Um, I think one of the big questions when it comes to vitamins and kidney disease is, people are always asking, like, which ones should I take? Is it okay if I'm taking this much? And I think there's a lot of concern because a lot of the vitamin supplements, they have like how much of the RDA or the DRI or whatever that they're meeting. It's like these gigantic percentages, and people are like, like, is that making extra work for my kidneys to have to filter all that out? And, you know, why do they keep putting this much stuff in here? Should I only take this vitamin like once a week now? Like, it gets pretty confusing.
Mm-hmm.
Um, and so the first thing that I always like to clarify about the recommendations or the DRIs is that there's a really small umbrella of people that those DRIs are really meant to apply to. It's really only healthy individuals that are at a normal weight. So especially for our kidney disease population, technically the DRIs are completely irrelevant. Now, some of them, there could be some crossover, but it hasn't actually really been verified, right?
Mm-hmm.
So anybody that has any kind of chronic disease that is very physically active, is at a lower BMI or a higher BMI, then the DRIs are maybe not really that applicable to those individuals. And also, I feel like it's a helpful reminder too that these daily reference intakes or the DRIs, they were established like in 1998. Some of
Yes.
them are older than that, and some of them
Mm-hmm.
are slightly newer, but that's kind of like the main ones that they did. And they looked at the height and weight tables from NHANES 3 data from 1988 to 1994.
Yeah.
And a lot of the vitamin and mineral recommendations are based on weight. Like a lot of times when we see like men have higher recommendations than women, it's because men have more weight. I don't know, but that's what it said. So, um, yeah. And so there's definitely a lot of kind of interesting assumptions that went into those. And again, as you and I have talked about, the DRIs were really designed how to not die. Like, that is the
Yes.
focus. Like, what's the
It's not
smallest
optimal
amount?
health, no.
Yeah, what's the smallest amount of vitamins or minerals that you can take before getting like some really bad
Kirby.
symptoms or
Yeah.
dying?
Yes.
And I don't really feel like most people are aiming for that. They're like, well, how do I like really feel well?
Mm.
What is an optimal amount? And truthfully, it is a tough question to answer, even if you don't have kidney disease, because there's just not very reliable testing. There's a lot of factors to consider. There's just a lot of things. And so, that's the first thing I always say is that the DRIs are the bare minimum amount that we
Yeah.
need. Um, so when you see those really high levels, that's not necessarily bad or good because we've got to look at a few other things. So hopefully that kind of helps people breathe a little sigh of relief on that. Um, so the Kadoki guidelines that came out most recently, which some of our viewers will be familiar with it, some won't, but the Kadoki guidelines are a really nice resource. They look at a lot of different research and studies, and they try and put together some recommendations to help guide providers so that they're like, hey, this is an evidence-based recommendation to start with. But at the very beginning of the KDOQI guidelines, they state that these guidelines should be individualized, that they are not a protocol to blindly follow. And so always keeping that in mind. And I feel like that is a really nice thing to remember when we look at their vitamin recommendations, because they do recommend going off of the RDAs or the DRIs for vitamins and minerals. And they list that as an opinion. It's not like expert or like anything like that. But I don't know. I feel like they just really, maybe looking at it, didn't really find good research to make a recommendation different. They couldn't make a specific recommendation that was different than the RDA. So I feel like that's why they went with it. So it's a little bit confusing for people, because it's like, well, it says to go by the DRIs or the RDAs. So what is this about? A really good example for this is vitamin C. Vitamin C is a really, really popular supplement, right? And for people who have kidney disease, vitamin C is a pretty hot topic. And so we have done a lot of looking into that and figuring out like where, our stance is. So there are some reasons why it's reasonable to not have a high intake of vitamin C. If you have any kidney related issues, one of the most common ones people hear about is kidney stones. And so the kidney stones can definitely be impacted by vitamin C. I'm pulling up a couple of my notes here. So the research found that people who had vitamin C in doses of greater than 500 milligrams a day, that would increase their oxalate levels. So if you are an oxalate stone producer, then you would want to keep your levels below 500. And they also said that if you have vitamin C intakes of greater than 1,000 milligrams a day, then that in general, that's just going to increase your risk of kidney stones. So, but I think the thing to also remember is that vitamin C, just because you take that vitamin C pill or that, emergency drink with it in there, that doesn't mean you're going to absorb all of it. And most of the time, people are only going to be absorbing a maximum of like 100 milligrams at a time. And so, like, there are times when your body may have a higher need for vitamin C, like if you got exposed to a cold or a flu virus or things like that, where your body is going to need some extra immune support. And taking a little bit higher dose for that short period of time is not going to like all of a sudden, oh, now here comes a kidney stone because of that. So it's going to be consistent, really high doses, and probably in doses throughout the day because of the absorption issue. And for people on dialysis, that recommendation of not having a lot of vitamin C seems to carry through because of a lot of, I don't know, unusual ideas. But in the beginning, dialysis didn't remove oxalate very well. And so it was a concern. But now dialysis does remove oxalate pretty well. And the interesting thing, and this is what I kind of wish the guidelines had at least mentioned, that the studies show that dialysis does remove vitamin C. It's varying amounts, whether you're on peritoneal or hemo, but up to 90 milligrams per dialysis treatment. And when you look at the data for how much vitamin C people actually eat in a day, it is usually less. And so people are going to be in a fairly consistent vitamin C deficit if they're on dialysis and really limiting their vitamin C. So I don't think the RDA is adequate because the RDA is, going to be essentially removed from dialysis. So you have to make up for that. For people who don't have a risk for kidney stone and people who aren't on dialysis, it is really likely that anyone who's in a consistent inflammatory state, if you have an H. pylori infection, if you are healing tissue, repairing tissue, vitamin C, along with other nutrients, is pretty critical to have on board. So
Yeah.
don't go wild with it. Don't be having these mega doses of vitamin C, but work to get, good amounts from your diet. I think 100 milligrams a day, like just on average, is not an unreasonable amount. But it's really helpful to talk with a healthcare professional to see, are there reasons that I should be lower, or do I need a higher amount? And there are some types of testing that maybe we can talk about at the end that can help you get a little bit more precise number. So vitamin C is a big one in kidney. So I think the takeaway from that is, don't be super afraid of it, but don't be taking mega doses, mainly because it doesn't do much. You're not going to absorb it.
No, and I think the research too is pretty ambiguous on vitamin C. I know when we looked, it's one of our core nutrients, and a lot of that's research about it causing kidney stones. It's a bit like potassium. It was taken from the 80s. It doesn't have a lot of research to back it up, and it was only in men in certain.
Yes, thank you. Men, it was particularly specific.
Yeah. It doesn't seem to have that same action in women for whatever reason, which again I find fascinating. But it's an ambiguous one. I love it because it's obviously antioxidant, anti-inflammatory, which are the two main drivers of chronic kidney disease. But like you say, it's a water-soluble vitamin. Unfortunately, it's a nutrient that you take in and you move most of it out being water soluble, which is why when you take mass doses, you get diarrhea, because you hit bowel tolerance with it, right? And that's everybody has a different level of bowel tolerance. So it's not a greatly absorbed one. You have to take microscopic amounts regularly, really, for vitamin C to work. And so it's
that's
definitely,
yeah. And I think that's why diets are nice ways to get that vitamin C in, because you are going to be getting it in those smaller amounts throughout the day. And, most vitamins and minerals are really synergistic. They like to work with other vitamins and minerals to improve absorption or function in their various pathways. And I think that is probably another thing too, of why a lot of times they're like, oh, vitamin C, because a lot of research with individualized minerals and vitamins, it doesn't show benefit. But diets high in those minerals or vitamins do show benefit. And I think that synergistic effect is really important to consider.
Yeah, no, it's a really good point. Okay, what's next on your list of vitamins?
Vitamin A.
Oh, yes, a good one.
So, yeah. So everyone is always really concerned about vitamin A toxicity and kidney disease.
Yes.
So interestingly, when I actually went and looked at the research, it's pretty controversial in the paltry amount of research that there is. So just assume overall there's not very much research on vitamins and kidney disease. So that's a given. There's not going to be great research on it. What they found, so I think the reason for vitamin A toxicity is that people who have kidney disease seem to have 3 to 4 times the normal vitamin A plasma level. So it's just higher. But the thing that I think is an important consideration, they do not have toxicity symptoms.
Exactly. It's such a good point.
So the other thing that they found, and again, these aren't clinical trial type ones. Most of these vitamin studies are going to be just observational type ones. So that's what they're finding. The other thing they found, for instance, in dialysis patients, hemodialysis patients, people who had the lowest vitamin A levels, even though it was above the normal concentration, they had increased risk of mortality.
Yes, I read that same study, which I found fascinating. And then you go, is there a mechanism going when you've got chronic disease, why people have high plasma vitamin A? Maybe that's a preservation mechanism happening in the body to prevent stuff like that. It's fascinating.
Yeah, it is really interesting. And I was kind of thinking in my head, I'm like, yeah, why is this the case? And I mean, when you think about what vitamin A does, there's a lot of things that certain vitamins are, kind of famous for. So I think a lot of people for vitamin A, they think of like eye health and things like that. But vitamin A actually, it plays a really important role in like cell differentiation, so that, you know, your cells know that they have different jobs and they can do that.
Mm-hmm.
Also with healing and tissue repair.
Mm-hmm.
But also it's an antioxidant. Has a lot of antioxidant activity too, right? And so it kind of makes me think of that with, you know, vitamin C and increased needs, you know, well, yeah, maybe it's because there's so much inflammation running around. The body's like, we're pulling all hands on deck to try
Mm-hmm.
and get some extra support here. And maybe that's why vitamin A levels are increased. Um, but vitamin A also helps mobilize iron from storage sites in helping to develop red blood cells. So I feel like there's a component with the anemia issue as well.
Yeah, and lots of people don't know that vitamin A is actually really quite critical in that pathway. So,
Mhm.
yeah, and again, we know that EPO production is going to go down if you've got CKD, and of course, anemia being a big part of it. That whether the body's mobilizing more vitamin A, particularly to upregulate that whole process, would it makes sense, right? The body's so amazing; like it always wants to move you towards homeostasis and healing. And so, when we hear about studies having people with higher plasma levels of vitamin A, you go, well, if that's commonly happening in CKD, I can only imagine it's a mechanism of the body trying to move itself back to health and homeostasis. So all of that makes sense, right? And so then we have an increased need for it potentially.
Yeah. So I agree, definitely a potential need for more vitamin A, especially if, you know, we know there's always, you know, some level of inflammation going on, but sometimes we see like these weird spikes in ferritin, and it just makes me wonder if we're missing out on, because iron metabolism is pretty complex. There's a lot of vitamins and minerals that can help mobilize, you know, iron out of storage to be used in red blood cells, and vitamin A and vitamin C are two of those that happen.
Mm-hmm.
And it just makes me wonder, you know, if it is lower levels of those that cause like these unusual spikes that we see sometimes in the ferritin with our CKD patients. Because the iron's there, but it's just not in a form that's available to be put into the red blood cells. So I think takeaway from vitamin A is that one, again, this goes for a lot of vitamins, is that we don't have reliable testing to see how much vitamin is present in the body, because there's usually a lot of different forms, and vitamin A is definitely, there's tons of different
Mm-hmm.
things that kind of happen with that. And so we maybe need to check a different form, or we need to check different types of things to really assess what's going on with it. And so that, you know, kind of considering, you know, are there toxicity symptoms happening if, you know, vitamin A by some miracle actually got checked in the first place. But don't be afraid to be eating, you know, foods that have vitamin A or beta carotene or retinols in them, because, you know, a lot of them are going to be in, you know, lovely fruits and vegetables, or even those high quality protein foods that your body probably needs. So yeah, vitamin A. I love to talk about the most controversial ones first and get that out of the way.
What else have you got for me there? Who's next on your hit list?
So I got just B vitamins in general,
Mm-hmm.
because I feel like that's one where like a renal vitamin is a pretty common recommendation. I feel like a lot of nephrologists are pretty comfortable with that. I feel like you know, especially for dialysis patients, like they're getting that because vitamins removed during dialysis, whatever. Um, but even looking at that, I still wonder if the vitamins in there are quite enough.
Mm-hmm.
There's definitely a lot of my clientele that are in that stage 3, 5, not on dialysis, where they get pushback of if they want to take something that's not a renal vitamin. And I wonder if some of it comes, there was a study that was done, it's clear back in 2010, they looked at the effect of vitamin B therapy on the progression of diabetic nephropathy. And it was a large-scale clinical trial. And what they found was no treatment benefit, and our trial demonstrated harm. So it would be prudent to discourage the use of high-dose B vitamins as a homocysteine lowering strategy
I
outside
read
the
this same
framework.
study yesterday. That's hilarious that you say that. I was
Yeah,
looking at the vitamins for the Kajabi for you. So yeah, there you go. I
yeah,
literally went past that one yesterday. I was like, harm? What?
yeah. And so I read that and I was like, okay. And when I read through the study, I was like, that conclusion seems reasonable. If you're looking to try and lower someone's homocysteine levels, just B vitamins is not going to cut it, and it could cause harm. Get it? Love it, fine. And when you think, like, you know what you know about methylation, you're like, well, there's a few other like key things missing, like magnesium, and I think zinc is in there. And then what if the person has an MTHFR SNP? Like, those are things that weren't really considered in this study, which is fine, whatever.
Yeah.
But the beef that I have is that sometimes professionals who you think should know how to do their job actually do a really bad job. So this was produced in UKidney by a person who is the assistant professor of medicine. And the title for this, so his review of this study was vitamins are harmful in patients with chronic kidney disease. And his takeaway, his conclusion was the study shows that people with diabetes and kidney damage should not take high doses of vitamin B and folic acid. So right there, that's confusing. This does
Yeah.
not mean you should stop taking a prescribed daily multivitamin. Multivitamins have much lower doses, and there may be other benefits for you. Like, how much is even actually right about that statement, regardless of what the study actually said? Like, there's nothing right about that. And then it's just very confusing because vitamin B, what, like,
So yeah, which one?
and
Between one,
folic
two,
acid,
three,
which
five
is,
is a
yeah.
B
And so
vitamin. Yeah.
I was just like, oh my gosh, this is so unfair to our patients and unfair to other providers who are trying to be informed about things. There's so much confusion about even B vitamins.
Yeah.
And so we use sometimes a test called NutriEval, which allows us to look at the vitamins and minerals kind of in action in the person's system. It's a urine and a blood test. And from those, we have gotten fairly consistent results about people needing very significantly higher amounts of those RDAs or DRIs. So
Yeah.
as an example, like thiamine, like I think the RDA or the DRI for that is like 1.5 milligrams.
Oh,
And
tiny.
yeah, so little. And when we have our clients do the NutriEval, consistently like 25 milligrams. So that's a really big difference. But when you know what we know about thiamine, that uremia downregulates thiamine transporters, and thiamine deficiency makes people is a 2 times higher risk of heart failure in people who have CKD.
B1, Simon, right? Simon, B1, yeah.
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 And thiamine deficiency has a lot of similar symptoms as congestive heart failure.
Yes, exactly.
And so it just makes me think, like, as an example, like if we were giving our patients 25 milligrams of thiamine instead of that 1.5, especially for our patients who had symptoms of congestive heart failure, is there a difference? Like, that would be a very interesting study that needs to be done. So, but I feel like that is one reason when we know that the body can't transport thiamine around really well. So if we have little paltry amounts, like what percentage of that is getting transported? People probably need a much higher amount to have functional thyroid in their system. So there's a lot of things that are kind of like that with CKD, that there's just things that aren't working quite as well. So you need more amounts to make things work.
Yeah. So what's your takeaway with B vitamins? Because it's funny, we recommend Bs, but again, we'd probably recommend a Nutri-Eval or something like that. But again, we recommend testing for that. And of course, if you've got elevated homocysteine, you need the activated Bs. You need to check your MTHFR SNPs. You might actually need, and this is the thing, I'm like, well, maybe they were giving folic acid, and folic acid is damaging if you've got an MTHFR SNP. Are you more at risk of kidney disease with that SNP? I haven't looked at that studies. You might actually know that answer, but then we need to use 5-methotetrahydrofolate. So if we're using the correct form, maybe we wouldn't have issues, because if you're using folic acid and you've got MTHFR issues, you're going to backlog the methylation cycles, So
That's a really, really good point.
Yeah, is it that they were just using, I was going to say shitty, but crappy forms of B vitamins that are incorrect for the person, whether they should be using hydroxy B12 or methylated B12, methylcobalamin, was it as simple as that they were just using the wrong forms because maybe people with CKD are at a much higher risk of having MTHFR SNPs that are being turned on or lit up because of blood pressure, cardiovascular changes, or whatever, or the methylation cycles under more pressure because of kidney disease and inflammation, all the things that we know.
Mm-hmm.
And now people are going, this is why we need to work with a healthcare practitioner. But it's, that's where it's really specific nutrigenomics. Is that just the simple reason why all those studies just didn't show a benefit? Because maybe they missed out on a really just important fact that CKD requires methylated Bs because the methylation cycle is downregulated and homocysteine goes up, or whatever it is.
Yeah, I think you brought up a lot of reasons why we have bad research or not very much research on vitamins. It is complicated. Like, there's a ton of things that you brought up that either these researchers didn't consider, or it wasn't possible with, for a variety of reasons for them to, include those kind of lurking variables in their study in the first place. Yeah. So it is really complicated. So I found that for my clients, when we have them track their food, that 99% of them are not even getting the RDA or the DRI of the B vitamins. And that level goes up somehow even more when people are following a low protein plant-based diet.
Yeah.
They just don't quite get in enough of those. I mean, especially B12, we know on low protein plant-based diets, like there just really aren't very large food sources for that. And so you're going to need supplements. So I pretty much across the board will recommend supplements to my patients just because they can't even get in that really sad amount. Because it's a challenge because of a variety of reasons, like you're looking at people's food preferences and the time they have to put into food prep and all those kind of things that are impacting it. And so I recommend B vitamins, and a lot of times people are like, oh, well, my doctor just says that's expensive urine. And I'm like, well, I feel like that's a plus if your vitamin actually gets absorbed, because if you are peeing something out, that means you actually got it into your system in the first place.
Yeah.
I feel like most vitamins are expensive stool because a lot of them are just not going to get absorbed. So, and with the B vitamins, there is some of the byproducts. I think it's a riboflavin that makes things, look a little brighter than you may be used to when you produce your urine. But that just means, your body absorbed it and it's been metabolizing it and using it. So don't be scared of that color change.
Yeah. And this can get quite stinky in there too. I know my B vitamins. I'm like, whew.
Yeah, it definitely change that. And that's normal, and that's okay.
Yeah. Okay. What's after B vitamins?
So, one of the reasons that I like to recommend something outside of a renal vitamin for a lot of my clients is because of choline. Choline is something that, again, came more to the forefront as we had more people doing more plant-focused, low-protein diets, because our bodies do make choline, right? But the studies show, which granted, those are pretty old studies, but still, they show that even people who are fed a low, like, or choline deficient diet, their body does not make enough
No.
to make up for that. And there are some genetic SNPs that can kind of gum up that process on top of it. So if you're like me and have a choline SNP, then you definitely don't want a choline deficient diet. And choline is a little bit, controversial in kidney disease because when the body breaks down choline, it breaks it down into a uremic toxin, TMAO, right? So I kind of think of it the same way we think of protein. Protein is important. When your body metabolizes it, it breaks it down into uremic toxins. Does that mean that we deprive people of protein in favor of less uremic toxins? No, we don't do that. We try and find that balance with how much do they need versus how much can the kidney handle. And there's other things that we can do to kind of help reduce that production of uremic toxins working on the gut. But for choline, there's a lot of things that can go wrong with a choline deficiency, like fatty liver. That is a big metabolic issue that is happening for a lot of people. And it could be as simple as, let's just, give your body some choline. And that could really help.
Yeah, and I think people forget too, like, because your liver is one of your detoxification organs, that if your liver is not working properly or if it's gotten fatty, you're going to put more pressure on the kidney. So having a good functioning liver is imperative to good functioning kidney function. So
for sure.
And of course, your nervous system and all of those things that choline plays a massive role in as well, and mental health and all of those sort of things too.
Absolutely. And I usually talk about it as like the basics of every cell membrane is made up of a bunch of choline. Like there's a lot of that in there. So if your goal is to help heal and repair your kidneys or any other tissue in your body for that matter, you have to have choline. So if you're choline deficient, then what's going to happen? Not going to have healthy cell membranes. So there are some types of choline that seem to not produce quite as much TMAO. Citicholine, which has gotten a lot of spotlight for helping with dementia and Alzheimer's and stuff like that. So that's typically the type that I recommend to my clients as well, to help reduce that production of that uremic toxin. But I feel like it's really important to not be deficient in that. And again, on a low protein plant-based diet where eggs are pretty much like the best source of choline by a lot. Like they talk about like peanuts and cauliflower, and it's just like, are those really good sources, or are we just really desperate at that point to like include some sources of choline?
Yes. Yeah, I'm glad you said that, because eggs are and it's particularly the egg yolk, isn't it? That's the really high in choline. So
yeah. So if you're doing egg whites only, you're not going to get the choline benefit from that. And for thinking about heart health, there's always that argument, like, are eggs good for heart, bad for heart? Get pasture raised eggs, and those are good for your heart and for your choline, and they have better color and taste delicious.
Yes, and the trick to eggs is I'll never forget my nutritional teacher teaching me this: don't hard boil them. You want to keep the yolk runny. It's when it hard boils that you oxidize the fat in them, and then they become a higher risk for cholesterol. If the yolk is runny and you serve it with the egg white, like with all foods, and nature's so smart, it's the egg white and the egg runny yolk together that actually you shouldn't have any cholesterol issues with eating a soft boiled egg with the white with it, because it helps metabolize it all.
Yeah, just like what we talked about in our healthy fats episode, it's that oxidized fat that is really the oxidation. That's the problem for the cholesterol. So that's a really good point. I love that.
Yeah. All right. So we've had vitamin C, vitamin A, B vitamins, and choline. You got anything else on your?
Yes, I do. Biotin.
Oh, I love that you're going into these ones. Tell me more about biotin. I love biotin. So for people that don't know, I have MS, and I take whopping great big doses of biotin because they've one of the things they've proven is in secondary progressive MS that it can halt the disease. So I'm a Biotin fan. So tell everybody about Biotin.
So yeah, biotin is really important. It's super popular in the CKD world because a lot of people who have CKD have hair loss. That is the main reason that I see people taking it.
Yeah,
And
right.
so, yeah, I mean, people are just like, I mean, I understand, like, who wants to have a bunch of hair loss going on? And it's true, like, biotin, one of the symptoms of deficiency is hair loss for sure.
Mhm.
So, I was looking at this. So other things that happen that biotin actually helps a lot with is for fatty acid and carbohydrate and protein metabolism. So if you want your food to turn efficiently into energy for your body, you have to have biotin. So you don't want to be deficient in that, otherwise you're going to feel like a slug. And it helps with gene expression, and so we've got a lot of factors with DNA and stuff in there, cell signaling. Like it plays a lot of other roles, but no one really cares about that because you don't see that. People care about the hair. And
Nice nails. You
so,
get nice nails from Biotin.
yeah, the hair, skin, and nails, it's going to have biotin in it, right? So, really common for people to have hair loss with biotin deficiency, along with maybe like some weird rash stuff going on around like the eyes, nose, and mouth. And also, you get some different neurologic symptoms because it's playing a role there. So, obvious why you're a fan because, plays a role with that. So, depression, feeling really lethargic, sometimes hallucinations, numbness, like tingling, those kind of things. Those are all symptoms that, hey, you can have a problem with biotin. So we know that with kidney disease that there is impaired absorption. Um,
Hmm.
and so you're going to, and is that because people have a lot of uremic toxins and that's interfering with it? What's going on there? I don't think that's been really well like elucidated. Um, but of course, if you have any kind of GI issue, again, impaired absorption is going to be a factor on top of kidney disease. And then you do have some losses through dialysis if you're on dialysis. And then there are some medications that can increase your risk of biotin deficiency. So, but the interesting thing that I found was, does taking biotin really help with hair loss?
Mm.
And I
Right.
know that there is like anecdotal data that plenty of people are like, I started taking this biotin and my hair is growing back and it's amazing. I myself did not find that to be the case. So I kind of felt vindicated when I was looking at clinical trials. Um, Although hair loss is a symptom of biotin deficiency, no published scientific studies support that claim that high dose biotins really are effective in preventing or treating hair loss in men or women.
There you go.
And so then, of course, people are like, well, that's fantastic. What am I supposed to do about my hair loss now? Right.
Yeah.
So we're kind of straying into some like other vitamins or minerals or whatever. But hair loss can be from protein deficiency, iron
Mhm.
deficiency, vitamin D deficiency, autoimmune disease, or just really high amounts of inflammation. Like all of those are really common also in kidney disease. And once those are addressed, a lot of times people will see their hair grow back. Um, and I just think it's also kind of important to note that biotin can interfere with some of your lab work.
Yeah.
And
Forget me having a
so,
thyroid test. It's going to blow it out sideways.
yeah, it's really going to mess with thyroid labs
Mhm.
and PTH, parathyroid hormone.
Mhm.
It
Very much
also
mucks with
can mess
that.
with that.
Hmm.
And so um, just making sure I looked for how much biotin is too much to take to interfere with labs, and there was a really wide variety. But they said, biotin has a half-life of about 2 hours. So to be extra safe, avoid your supplement for just 8 hours prior to your test. And especially with intakes of greater than 5,000 to 10,000 micrograms. a day, which some people really are taking quite high doses. So I feel like that's important to note.
Yeah,
so
I'm taking that.
Yeah. So it doesn't mean you shouldn't take biotin, because, people who have kidney disease do have increased needs. But, talk with your dietitian and see like how much biotin are you really getting from foods. A lot of B supplements already have some biotin in there. So you may not need to be taking an extra supplement adding to your pill burden. And then if you are like frustrated about hair loss, then let's take a look at some of your other vitamins and minerals and see what we can do to help with that.
Yeah, it's interesting. In Chinese medicine, they say the hair is an extension of the blood. So, of course, because your kidneys are filtering blood, if you've got hair loss, then or toxicity in the blood, which we know is the kidneys are filtering, then that will help as well. That will lead to hair loss as well, or quality of your hair. So,
that makes total sense.
Yeah. All right. You got any more on your list?
This is the other big one that we talk a lot about in kidney disease, and that is vitamin D.
I was hoping you were going to get to vitamin. I'm like, she must have vitamin D on her list. I'm so glad.
I feel like it gets talked about a lot. And so people are just kind of like, oh, okay, yeah, vitamin D for kidney disease. I remember when I first started working in dialysis, which was a long time ago, they were just barely coming to the realization that vitamin D is actually really, really critical in kidney disease. So initially they thought, because the kidney is the primary activator of vitamin D, because vitamin D is kind of more like a hormone, it seems like, right? Like
It's
it has a bunch of different forms. Yeah, it has a bunch of different forms, and it needs to be active to do all these cool things. And the kidney is the heavy hitter for that. And so they thought, well, there's 0 point in checking certain forms of vitamin D, or even giving inactive forms of vitamin D, like if the kidney can't activate it. And so they were giving people like calcitriol, or like brand names like Zemplar or Hectorol, things like that, to help with the bone management. And second range calcitriol is that's like the first line therapy for that. But they started to recognize that you have little vitamin D activator sites all over the body.
Yeah.
And even in people who, I have my notes somewhere, they found that even the people who didn't have kidneys anymore, or who, had the unfortunate thing with like birth defects, born without kidneys and stuff like that, those vitamin D activator sites were still active. And so it is really important to get your vitamin D levels checked. And I feel like going into fall is an extra good time to get vitamin D levels checked, because vitamin D is one of the first line, defenses that your system has against cold, flu, COVID, all those things. Vitamin D is amazing for, outside of kidney disease. And so get that level checked. Because super important. But vitamin D, it helps with bone health. That's the most common thing in kidney disease that everyone is looking at, which is super important. But vitamin D has what they call endocrine and autocrine functions. So the endocrine function of its role with bone health, that's the really well-known discussed one in kidney disease. But the autocrine function, that's where we're getting that immune modulation, improved endothelial function, which is going to play a lot of role with your vascular and heart health. It helps with increased insulin. It helps with your blood pressure, specifically acting on that renin-angiotensin system. So you want to make sure that your vitamin D levels are healthy for a lot of those reasons to support your kidney. But outside of that, vitamin D does a lot of good things everywhere else in your body.
Yeah, and I think they found too that the lower your vitamin D, the higher the risk of mortality with chronic kidney disease, the faster the rate of kidney disease progresses. And I'm convinced, after I've gone back and forth through this FGF23 pathway and phosphorus, that long-term chronic vitamin D deficiency is a precursor to renal failure. I'm so sure of it because of the way the FGF23 phosphorus pathway, which goes out 10 years before we'll even see changes in EGFR. So, and I'm convinced, and that I think that's also why we see a higher rate of kidney disease in the Indian population, in Hispanics, the darker skin, because people think the darker the skin you have, you absorb more vitamin D, but no, the darker the skin you have, the more likely you are to have a vitamin D deficiency. So because it's the melanin will sort of reflects it back, the sunlight and the activation of it back off. So yeah, there's so many studies to show vitamin D deficiency, and especially in later stages, will accelerate you towards needing dialysis and mortality rates. So it's so important in CKD.
It is. And it's honestly like, because there's so many other things that it does, like it's just like a no-brainer. I always tell my clients, get your vitamin D checked twice a year, like January and July. Just get it checked and make sure that you're on track, because super important. And I have seen that a lot of doctors, they do check it, and but clients end up getting like a big dose that they take just like once or twice a month. But again, the studies show if you want that immune support, you have to take smaller daily doses.
Yeah.
And
that's
so
the point.
yeah. And so for my clients, when my nephrologists were really awesome about that, and we checked our clients, you know, every January and July. And I found, so I live in Idaho, my patients who had less than 2,000 IUs were never able to maintain their vitamin D levels.
And that's a decent dose. It's not small. Like in Australia, we're not allowed to dose over 1,000 a day or get capsules over 1,000. And I'm like, that's well under what I see people do. I've seen about 5,000 in CKD, even sometimes 5,000 most days, and maybe a couple of days of 10, you know, like that's.
Yeah, definitely higher. So the RDA is set at 600 IUs, which again, to me, like nobody is able to maintain a healthy vitamin D level at that amount. Like food sources for vitamin D are very few and far between. And so that's just been my clinical experience. And your weight level does seem to play a role, because vitamin D is a fat soluble vitamin. And so if you have a little bit more adipose tissue, it's going to get stored in there. And so you may need a little bit higher dose to even get your vitamin D levels up to what they need to be. And the minimum is usually 30 in your lab tests. But to get all those autocrine benefits, I feel like it's usually more between like 60 and 80 that you want to see on your blood test results. Is that?
Yeah. And Australia has different reference but I would say 120 to 150 if you've got CKD is where you want your, for the Australian labs, it's where you want. I sit my MS patients right up to 200. Mine sits in toxicity levels, but I've got no toxicity symptoms because of its role in autoimmune diseases. So I sit mine really on the high side along with my biotin. So
yeah, definitely autoimmune disease. You're definitely wanting those higher levels. And again, I'm just hoping that we see some more research where people are so afraid about toxicity that they're happy living in deficiency, not really seeing all of the really horrible things that kind of end up happening when you're living in deficiency levels of all of these different nutrients. I feel like, you know, we could go through like all of them and be like, these are all important in kidney disease. So I'll just mention vitamin D and vitamin K seem to have a really synergistic, beneficial relationship in kidney disease.
Yeah.
Again, along the lines with bone health, because of that increased risk, everyone's, you know, worried about high phosphorus, high calcium, higher PTH because of the calcification that can occur. But they found, especially in people who use warfarin, that you have even more increased risk of calcification. But if you introduce vitamin K, then that risk is significantly lowered. And I feel like this is a big deal too, because they have done studies about for people on dialysis, their fistula longevity, and that calcification is a big problem. And, you know, when you're on dialysis, that fistula is your lifeline. And if you can reduce the need for a new fistula or surgery or, revisions because of calcification by just adding a little bit of vitamin K in with your D supplement, that seems like a no-brainer to me. But people who have kidney disease tend to have, all the studies, observational studies show low vitamin K all the time. And partly I think there's diet factors, but I also think because the gut can make vitamin K, if you have gut issues, you're not going to be making it. And so working on your gut is going to help improve vitamin K levels. So consider that with your D supplement.
Yeah,
Ask about that.
All right. Well, we've cracked some of the big ones. Is there any others you wanted to add to that lovely list of yours?
Wow. I feel like we talked a lot about, we've talked about most of them. Is there any other ones you wanted to touch on?
No, they were really the big ones for me. I was hoping you'd get to vitamin D. That was the one. If you hadn't mentioned that one, I would have been like,
save the best for last.
Yeah, exactly. I think as far as the vitamins go, they're the big ones. I mean, we've got podcasts on alpha lipoic acid and things like that, which, they're in that category, but they're a bit more ambiguous in CKD. But I think as general vitamins of what people would know, like A and C and B and D, I think we've covered the main ones. So it's brilliant. So again, I think the big point and takeaway too is just how individualized this is and how important it is to work with a healthcare practitioner, how important it is to have blood labs and tests, using something like a Nutri-Eval, which I know the team at K&I use, making sure you're checking things like vitamin D. And all of those things I think are super important, and knowing that maybe a basic renal vitamin may not have you covered. I think the other big thing I want to say is in the B vitamins, you really do need to know your SNPs. You need to know, if you're carrying MTHFR genes, and knowing that, the MTHFR A1C and the 677T, they're the two big ones, but there are like 100 MTHFR
there
SNPs.
Are a few. Mm-hmm.
Yeah, and that, you might have, those ones might be normal, but others won't be out. And I also want to say, just because you have a SNP, it doesn't mean it's expressing. But if you've got something like CKD, there's probably a good chance you might just be heterozygous, meaning one fault on the C677T MTHFR gene. But that's enough because you've got kidney disease that methylation's backjammed. And that's where it's really important to make sure that you've got a good healthcare provider that understands this stuff, that is checking, that aren't giving you things like folic acid, which will, like we mentioned in the studies, it will jam up that entire pathway if you can't metabolize it properly. So again, I think when it comes to vitamin and minerals, working with someone like Lindsey or someone from the K&I team is just super important to make sure you get that right.
Yeah, we do like to do some, genetic SNP testing, like with 3x4, and do a Nutri-Eval with it. So we can see like, where do we need to look, what SNPs might be expressing, and verify that.
Yeah, I really think vitamins, even more than minerals, I think that's really important to optimize. Yeah. And so you're saying you're not getting really expensive. Well, we don't mind expensive urine, but we don't have an expensive stool. So getting all of that stuff right.
Exactly.
Yeah. Perfect, Lindsey. Well, I always appreciate your wisdom and your knowledge. If you want to connect with Lindsey, you can do that from anywhere in the world. I'll put the link below, but they're the Kidney Nutritional Institute team. Lindsey's on the page there, they're .org from memory. And you can book a consult. They'll do telehealth and work with you one-on-one to really get you set up and making sure that what your diet is doing and the supplements that you're taking is bang on. If you want to know more information about what we do, you can head to www.kidneycoach.com. You will find our shop there. We've got renal supplements and herbs there as well. Make sure you hit subscribe and like. That way you'll get notified anytime we put out a new video. And if there's any content that you want Lindsey and I to talk about, or anyone else, make sure you drop it in the comments below and let us know, and we'll make sure we do that. Lindsey, thanks again for your time. As always, I always appreciate that amazing brain of yours. And thanks for being part of our team and community, everybody. And thanks for listening. See you next time. Thanks, Lindsey.
Thanks, everyone.
Bye.